Help! I have a headache or pain, but I'm breastfeeding. What can I safely take for me and for baby? Well, first, if you have a new onset headache, start by drinking some water. I see many new mothers who are breastfeeding who are not getting adequate nutrition and hydration because they're so focused on taking care of the baby. So if you have a new headache that just started, before you reach for that medicine cabinet, make sure you start by getting hydrated. That can look like water, coconut water, soups and broths, maybe some herbal tea, high water fruits and vegetables like melon, pineapple, citrus fruits, cucumbers, a good old salad. If that doesn't do the trick, then there are some safe medications that you can take. Dr. Hale, who wrote the textbook on medications and mother's milk, categorizes medications in 5 categories. L1, which is the safest medication, L2, which is safer, L3, which is probably safe but maybe consider a different medication, L4 is possibly hazardous, and L5 is definitely hazardous, do not take while breastfeeding. If you have pain such as a headache, body aches, post-delivery pain, or a fever, there are safe medications to take. Ibuprofen, Advil, and Motrin are all non-steroidal anti-inflammatory analgesics, or NSAIDs, and are considered L1 or the preferred medications while breastfeeding. Panadol, acetaminophen, or Tylenol are also pain relievers that are considered L1 and safe while breastfeeding. So those would be your first line of defense if you have a headache or some kind of pain. Aspirin, ASA, is considered an L2 medication. While L2 medications are typically considered safe while breastfeeding, aspirin can lead to a condition in babies and children called Reye syndrome, which has been associated with brain and liver damage. So it's not the preferred medication if you are breastfeeding. Aleve, also known as naproxen, is considered an L3 medication. And while the American Academy of Pediatrics, the AAP, says that it is approved for nursing mothers, Dr. Hale states that it should be used with caution due to its long half-life, meaning it stays for a really long time in the body, and it has the potential effect on the baby's cardiovascular system, kidneys, and GI tract. So use of Aleve should be short-term, infrequent, or occasional use, which would still be considered compatible with breastfeeding. Ibuprofen or acetaminophen, Tylenol, Motrin, these are all better choices over aspirin and Aleve or naproxen in the lactating woman. And you would want to discuss with your healthcare provider the risks and benefits of those other medications if that is what's being recommended to you based on your unique medical history. Codeine is an L3 medication and not generally recommended while breastfeeding. If it is essential for your unique situation and only where there is no other alternative, it should be used at the lowest effective dose for the shortest amount of possible time. And you should stop taking it and seek medical attention if you do notice side effects in your baby, such as breathing problems, lethargy, poor feeding, drowsiness, or a slow heartbeat. If you have another medication that you take for fever or pain, you can always ask an IBCLC lactation consultant that you're working with to check its safety in the textbook. Or you can search on the LactMed database, which is an online database that has all of the known medications in breastfeeding. You can also, if you're in the United States, call the Infant Risk. Infant Risk is a phone hotline where you can check your medications and their safety for breastfeeding based on you, your baby, the age and weight of your baby. That you can actually call in the United States, and the phone number is 806-352-2519. Again, that number for Infant Risk is 806-352-2519, and they are open from 8 a.m. to 5 p.m. Central Standard Time and can answer all of your questions. Again, always check with your prescribing physician before starting any medications. And if you have any concerns about your medications, there are really good, reliable resources. Most of the time, you don't need to pump or dump or to wean to take most medications. For fever, pain, anything like that, again, consider your L1 medications first And if you are being prescribed a medication that is considered L2 or L3, make sure that you discuss that with your providing physician first. There is something to be said for the age and weight of your baby, how long you are into your breastfeeding journey, and how much breast milk your baby is getting when you're considering going on any kind of medication. Typically, if they would have prescribed it for you on the floor for labor and delivery, such as post C-section or post-delivery, it would be considered safe to take while breastfeeding. Now you know.